Hi everybody. How does Krystexxa work? Krystexxa is a medication that's used to treat patients that have severe gout. What is gout? Gout is a condition that people have. It's very painful. Okay, it's a condition that people have when their bodies cannot excrete uric acid at a fast enough rate to the rate at which they're making it. So this uric acid tends to accumulate in the joints. So it can accumulate in the feet, in the knees, in the elbows, in the ears. Initially, when your doctor tries to treat you, it may try you on some pills, but if you have severe joint damage, then they may consider a medication called Krystexxa, which is an intravenous medicine that's used to treat gout. So there is a scan, it's called special scan, it's a specialized CT scan, and what it does is it looks at your legs, and because the feet is the most common site for depositing uric acid. So it looks at your legs and it identifies and can quantify how much uric acid you actually have deposited. And so once it identifies how much uric acid you have deposited, your doctor can discuss with you whether this medication called Krystexxa is helpful. One other additional reason to be on this medicine called Krystexxa is that the uric acid is damaging the joints. So there's the issue of the pain, and there's also then the issue of what is the quality of life that one has if the uric acid has been allowed to damage the joints unfettered, right? So that's why we're really thinking that this medication will be helpful. Krystexxa is what's called a biologic. So it's a biologic because it targets a particular problem, right? So the problem that this medication targets is the uric acid is forming lumps. So it goes in there, actually just dissolves the uric acid, like it's an enzyme, dissolves the uric acid so that it's in a form that can be excreted. So how is Krystexxa given? It's given through a vein. So there's a small needle and a little catheter, and it goes into the vein, and it's given every 2 weeks. How long is Krystexxa given for? Its commitment may be 6 months or longer. Really depends on how much tophi is there. Typically with my patients, we'll do a CT scan at the 6-month mark, that dual energy CT scan, and it will really help us gauge so we have something concrete to compare our progress to, and then decide if we have to use it for longer. So far in our clinic, we're typically about 1 year. I know there are some other clinics that are using it for more than 1 year out, but I think no matter how much you've been able to achieve with lowering your uric acid, I think it would really be very helpful to do it for as long as is feasible. Big issues with Krystexxa, big concerns that people have is the risk of allergic reaction. So prior to about 7 years ago, we didn't have a good answer for allergic reactions. Allergic reactions are now at a minimum because there's a medication called methotrexate that we use. So methotrexate has been available in the world of rheumatology for the last 60+ years, and we use it very commonly. One of the things that we use it for is to prevent allergic reactions to medication. So in our line of work, we do that all the time. We'll give you some methotrexate to use in addition to your Krystexxa. So the methotrexate are pills. Typically, you're taking about 5 pills once a week. Let's say Mondays a day, you take the methotrexate, and that actually prevents your body from developing antibodies to the Krystexxa. The other thing that happens is that we check your blood and make sure you can tolerate the medicine. So there's something called a G6PD level, and we will check it to make sure that you can actually tolerate using the medication called Krystexxa. And so how is it given? It's given in an infusion center. Very, experienced nurses are giving it. Typically, we would check your uric acid. So there are many things, because of the risk of allergic reactions, there are many things that we do to try to prevent allergic reactions from happening. So one is the methotrexate that we mentioned. 2 is to check your body and make sure that you have an enzyme that you can process. And then finally, it is also we check your uric acid levels kind of like a few days before your infusion. And the reason we do that is that if your body has started developing antibodies to the medicine, then your blood uric acid level will rise. And if your blood uric acid level rise, it's kind of a warning for us that, hey, this person may be at risk for an allergic reaction. And so your doctor will decide whether or not you should continue on the medicine. So 3 very good fail-safe minimum things that we do to prevent you from developing an allergic reaction. People that have kidney disease and liver disease are actually candidates for it. It doesn't interfere with liver or kidney. So hopefully this has been able to answer questions for my patients that are going to be started on Krystexxa or that have heard about it. So my name is Dr. Arinola Dada. Follow me on Healthy Joints, Healthy Lifestyle Show for more tips about medications that your doctors may be recommending or more information about your condition. For also share this video if you think it's been helpful. We're in the greater Seattle area. If you have gout or you know anyone who has gout, please share this video with them. I have them check us out at overlakearthritis.com. We have a team of doctors, nurse practitioners, and providers that can help you to a healthier version of yourself. Take good care. Bye-bye.